Winston-Salem is known as the city of art and innovation, and to meet the needs of the performing arts community, Wake Forest Baptist Health has opened a new clinic dedicated to performing arts medicine. The program is the first of its kind in the Triad and just one of a few in the nation. When it comes to sports medicine, images of dancers, musicians, and vocalists may not come to mind. But doctors at Wake Forest Baptist Health say the repetitive nature of these activities can result in injuries due to poor technique and posture.
A dancer may have problems with his or her lower back or hips, knee, etc. A musician may have a lot of demand on the shoulder, wrist, and hand, and vocalists obviously on the voice box and the shoulders.
Dr. David Popoli is the founder of the Performing Arts Medicine program. The clinic, which opened in early May, is in the Orthopedic and Sports Medicine Stratford building. Dr. Popoli says performers can often feel left behind by the medical system.
The demands of their job are similar to that of an elite level athlete, maybe just weren't able to find the same level of care.
Some of the common conditions treated include tendinitis, sprains, concussions, and more. Dr. Popoli says a typical clinic appointment runs about 60 minutes.
Bringing the dancer out to our dance floor that's in the physical therapy clinic and actually getting a co-evaluation with me as well as a physical therapist while he or she's out on the dance floor.
And get this, many of the health professionals in the clinic are artists themselves.
I was an actor. One of our physical therapists has some background with dance. And then one of the surgeons that works as part of the clinic was a professional drummer.
Providing high-quality care to get dancers back dancing and musicians back playing is what Dr. Popoli says it's all about. So the clinic is accepting appointments. For information on how to book an appointment, look for this story on our website.
That is so cool. I never would have thought, thought that they would bring this type of medicine or treatment to a city where they have a lot of the arts. I mean, but it makes perfect sense.
Exactly, and I like how you made that correlation between they're just like athletes, especially when it comes to like dancers and different things like that. I played piano for several years, and my teachers always stressed the importance of good posture, not dip too low, because you can really get some injury to your wrists there.
Like carpal tunnel?
Yeah,
okay.
You can, it affects the way you play too. So, and just the fluidity of playing, but posture was always stressed because you can get injuries.
And I love the part where they said that, some of the employees there were in the arts or currently in the arts, so they can understand some of the ins and outs of what they're dealing with.
Yeah, and the vocabulary that's used as well. One thing he said, beyond vocal performance, like singing, they work with people like us who speak for a living too. So we could go there if we had something wrong with our vocal cords or anything like that.
You can hear it probably, right? I have a sinus infection, so I'm not sure they could help me with that, but I've got the antibiotics, so I'm good. But yeah, so there you go.
All right.